Sometimes you might be working in support of a person with an intellectual or developmental disability who doesn't communicate well with words, and it might be clear that they're having some pain, and you've maybe assessed for the routine things, but can't find what's going on, what might be causing this pain that may be causing a behavioral change. Clinical Pearl number 43 from the book Clinical Pearls in IDD Healthcare talks about elusive causes of pain, hidden causes of pain, and adverse behaviors in people with IDD that we often don't think of. So I'll touch on a few of them today. One of the first things to think about is dental pain or oral issues. It can be anything from a small ulcer in the mouth, they could have bitten their lip, that could be sore, all the way to a big dental abscess or some other problem. So always think about oral issues when you see changes in behavior that might be indicating pain. Sinusitis is also something that you might not necessarily think about. And the person doesn't always have to have a runny nose. Maybe they started with an upper respiratory tract infection and then that developed into a sinus infection. They're not really having as much stuff that's coming out, but they're having a lot of pain, facial type pain. Ear infections. Constipation, don't forget about that. I know we've talked about that before, but constipation can be a big cause of discomfort that can result in adverse behaviors. Gallstones, gallbladder disease, that can be hard to diagnose or figure out sometimes as well too. Arthritis, there could be a hidden fracture, infection of some sort somewhere can cause a problem. Even something as small as maybe a little ingrown toenail. Think about those types of things. Sometimes it can be really simple. It could be that their clothing is actually too tight, causing some discomfort, and they become agitated from that. Lots of other different things that are on the list. Think about emotional distress as well, too. Maybe grief, maybe some sort of abuse. Never discount that fact. Always think about the possibility of abuse. There's some other things on the list, but just to help you think, always think about something that's causing a change in behavior and try to figure out what it is before treating the behavior with other medications or behavior plans.